everybody, welcome to another episode of Simply Healed. We are back on our cancer series, and today we have a very interesting topic, which is bone cancer. So let's welcome Doc Jansen with us again.
Yeah, hello everyone. Hello Shan. Glad to be here again. Yeah, our topic for tonight is going to be very interesting. So we're going to be talking about bone cancer and the different types of bone cancers, no, and what you can do about it. Yeah.
And for any cancer patient, bone cancer is still an important topic because there are two types of bone cancer, right? Primary and secondary. So can you share with us what's the difference? And for all the cancer patients out there, even if you don't have bone cancer, but you have another type of cancer, you'll be very interested to know about secondary bone cancer, which is actually your cancer metastasized to the bones.
Yeah, correct. So that's a secondary bone cancer. Let's say for example, you have breast cancer, it metastasizes to the bone, then you have secondary bone cancer. Imagine a piece of the breast cancer tumor. A piece of that went to the bones and stuck to that. So that is secondary bone cancer. So it's metastasis, bone metastasis in other words.
So that means, Doc, for example, if chemotherapy drugs are being used or immunotherapy drugs are being used, so they won't use a bone cancer drug for a breast cancer metastasized to the bone. They will actually still use
the chemotherapy appropriate for the primary tumor,
which is the breast cancer.
Breast cancer, yeah.
Oh, wow.
Okay, so there are a lot of different types of cancers that metastasize to the bone. One of them is breast, the other one prostate. There are many more. Okay, but that is what secondary bone cancer is. Now we have the primary. Okay, so let's focus on the primary first. Okay,
what's primary bone cancer?
So primary bone cancer is where the bones itself develop cancer. Okay, so it's your bone tissue forming a tumor. Okay, so that's different.
So it will be hard. Most of the time, it'll be hard.
Yeah.
Okay.
It's going to look like a callus.
Okay.
Yeah. Okay. So more often than not, primary bone cancers they usually prefer younger age groups. Now,
okay. So younger people.
Yeah, young people.
How young?
Kids.
How young is it?
From 10 years old. Actually,
really? 10
years old. As early as 10 years old, you can already develop primary bone cancer. Now, there are many types of primary bone cancers, but I'm going to be focusing on osteosarcoma because osteosarcoma is the most common primary bone cancer. Okay, and like what I said earlier, the age group where we can find this the most is from 10 to 30 years old. Okay, so more preferentially in the younger age group, and usually it's males.
So has it got to do with our testosterone? I mean, is it males grow heavier bones in general, right?
Yeah. It has something to do with the growth hormones.
Which is why bone cancer is not found in usually your spine. It's usually found
in the femur. Okay, in your thigh. Yeah, in your thigh bone.
Okay? Yeah, that's like one of the biggest bones in your body.
Yes. So it's usually found near the knees.
Near the knees.
Yeah, because that is where the growth plates are. So as a kid, of course, you are growing up so fast, right? That is where the growth plates are very active. That's why that is also the place where you can usually find osteosarcoma. Okay, of course, osteosarcoma can develop elsewhere, but it's most usually found in the lower extremities. Okay, so your femur, your tibia, the other bones, your legs. But osteosarcoma, if we are suspecting that, it's really easy to diagnose. A simple X-ray will be enough.
How would it look like?
Yeah, it's going to look like this. Okay, so the white part there, that is your bone. So take a look at the arrow. That is the osteosarcoma. So it's sort of like here's your bone, and around it is the tumor. So it's going to, if you open that
wrap
up,
around your bone.
It's gonna wrap around your bone. But
it's not like made from bone material. It's not like hard. It is because it looks porous on the X-ray. So maybe it's less dense than the bone.
Yeah, it is less dense than the bone because it's replicating faster.
Okay. All right.
So that's the reason why it's sort of like less dense. But if you open that up, it's going to be hard as well.
Doc, common facts about bone cancer. Is it common? And if you do get it, what is the prognosis? I mean, how is the chance of treating bone cancer?
Okay, so bone cancer is also a sarcoma. Okay, now for sarcomas, usually the prognosis is really bad. Okay, if you don't do anything about it. Now here's the SEER category, the SEER ranking according to the 5-year, according to the SEER stage, localized, regional, and distant. Now, if it is just localized, then the 5-year prognosis is good. It's 77%. But if it spreads regional, it's going to go down to 65, and if it spreads elsewhere, distant metastasis, bone cancer metastasizing, for example, to the
liver,
to the liver or to a distant organ, then your prognosis is going to go down up to 26%.
Wow. Doc, we were having a conversation just now. So actually, bone metastasis, not your breast cancer metastasized to the bone, but bone cancer metastasizing elsewhere is actually less likely because it's harder to spread. But if it does spread, it is usually
it's
very bad.
It's usually fatal
because the bone marrow is like the super expressway to
the other parts of the body. If when that time comes, the tumor is going to be so big as well, and most of the time your body will be under so much pain already that
you were not mistaken for anything else.
Yeah, correct. So
we know the prognosis. So what's the treatment?
Now, the treatment for primary bone cancer is simple: surgery.
So we cut it off.
Yeah, we cut it off, cut the limb off. That's curative. You will live a full life.
So you're like 100% cured.
Yeah.
But the thing is that you will lose the limb.
Yeah, that's the trade-off for this.
Okay.
Now, for tumors which are quite big or non-resectable tumors, so let's say for example, it grew in that part of the body where it is really very difficult to operate on.
Like your hip, for example.
Let's say for example, it metastasized to the hip bone,
or
it metastasized to the pelvis, for example. You cannot remove your pelvis. Okay?
Wow.
So in those cases, surgery is not an option.
Then what do they do then?
Yeah. They do chemotherapy and radiation therapy. That's the usual treatment modality that your doctors will do.
When I think about normal types of cancer, natural therapy comes to mind. But when I think of the bone, it seems like a hard thing. Is there like dietary things that you can do to help bone cancer?
Okay.
Is it the same? I mean, is it the same?
In terms of concept, it can be the same. Because the plant-based diet is the only diet that has been shown to have reversed certain types of cancer, like prostate cancer, breast cancer, colon cancer. But of course, bone cancer is a different type of cancer. It's a sarcoma, right?
It's a sarcoma.
So with that, you're going to it's also very rare as well. So there's not much study about it.
Okay.
Especially when it comes to dietary choices or dietary impacts.
Yeah, because not enough bone cancer patients to experiment.
Not enough sample.
Observe.
Yeah, number one, not enough sample, and number two, if you have this type of cancer, it's going to be removed. Number one, it's going to remove, or if it stays there, you don't get to live a very long life anyway because of the prognosis, right?
Wow.
So it's really very difficult to say that this type of diet is going to help it. It's going to help reverse it. But the only thing that we can do probably is to reduce the inflammation behind it.
So your lifestyle choices, can still slow the cancer down, make your body a hostile environment for the cancer to develop.
That's where prayers come in. I mean,
that's where we.
That's
where even doctors know their limitations.
Yeah,
right?
That's where prayers come in, and hope everything goes okay. Yeah, so. Because of the rarity, the severity of this type of cancer, there isn't really much treatment options available.
So it's basically surgery, chemo, and radiation therapy.
So with this type of cancer, it's really very important to catch it early and then have it removed early.
Right, because removing it is a 100% curative action.
Now let's go to the secondary bone cancer, which is metastasis. Now, bone cancer or metastatic bone cancer accounts for 5% of patients with metastatic cancer.
So if out of 100 cancer patients where their cancer spread, 5 of them will spread to the bone.
Okay. Now, this can vary widely depending on cancer type as well. Okay, so as I mentioned a while ago, depending on where your cancer or where the primary tumor is located, it can preferentially metastasize to the bone or not. Okay, so here's another one. More common organs that metastasize to the bone is prostate and breast cancer. Okay, so
we hear many patients with breast cancer metastasize to the bone.
Usually, for breast cancer patients, it metastasizes to the brain, bone, lungs. Those
brain,
organs.
bone, lungs. We need to cover brain, Doc, because I'm also curious. Obviously, we don't do much surgery for brain tumors, and chemo for the brain seems like it's gonna fry the whole brain. So it seems like radiation is the preferred for brain.
We'll have that for another episode.
Interesting, right, guys? Yeah. All right.
Okay. Now,
and then it's important to all breast cancer patients because if the metastasis comes, it goes commonly to your lung, bones, and brain. So it's tonight's topic is really good because breast cancer is so common among our viewers.
Yes. Okay. So again, with 70% of people with advanced prostate or breast cancer have bone metastasis. Okay, so it's a big
chunk.
Yeah, big chunk. No. So if you have stage 4 prostate cancer, stage 4 breast cancer, more often than not, you will have bone metastasis.
Doc, of all the patients that I've encountered with bone cancer, most of them are actually all of them are secondary. They always complain about pain. So bone cancer and metastasized bone cancer is more painful in general to other cancers?
Yeah, because the bones is actually it has a lot of nerves. It's very vascular, no? Contrary to popular belief.
Yeah, it's not a dense thing that you can hammer people on.
It's not like a wood, no? Inside the bones is actually penetrated by a lot of blood vessels.
And how serious that is.
Yeah. If you develop bone metastasis, usually patients survive around 6 to 48 months. So it's quite a long
quite a variation.
Quite a variation, right? But depending on how frail you are, depending on how strong you are, when the cancer metastasizes to the bone, it's going to be in this range. Yeah.
So now, the all-important thing, Doc, when we find out that we have bone cancer, be it primary or secondary, what can we do?
Yeah. Okay. So if you are suspecting bone cancer, so the first thing the first complaint that you will feel is of course pain. No. Now, if you feel pain, we have to distinguish that between a simple arthritis and an actual bone metastasis. Now, in the setting of if you're a cancer patient, no, and you feel pain, the first thing that your onco must rule out or your doctor must rule out is bone metastasis. Okay. Now, the number one request, the number one diagnostic test that you should undergo is a bone scan, a total body bone scan. Okay. Now, once you have underwent that bone scan, there are certain patterns that the doctor will be able to see in order to distinguish metastasis to the bone or a simple arthritis. Okay. Now, in this picture, this is what bone metastasis look like. Okay. So bone metastasis more often than not prefers the ribs, the spine, hips. Okay, the skull as well, even the collarbones. Okay, so in the central skeletal system. Okay, so that is where bone metastasis usually prefers to operate. Okay, now once you have this diagnosis, okay, we know that you have bone metastasis. Then next one is the other treatment options like nutrition therapy, chemotherapy, hormone therapy, immunotherapy, and of course you need to be on pain medication already. Okay, so those are the treatment modalities that you can have.
Doc, since primary bone cancer is usually treated with surgery, I mean we remove the limb. So really treatment variation comes in the secondary bone cancer. So am I right to say that whatever worked for, like, for example, breast cancer would actually work for breast cancer metastasis?
Yes.
All right. So does that mean that our PPARS protocol would then work for a patient with, let's say, breast cancer metastasized to the bone?
Yeah, of course. It will still work that way. I'll give you another example.
Do we have a patient?
Yeah, we have. I had a patient. This patient of mine has stage 4 breast cancer already, metastasized to the bone. But after taking PPARs, after undergoing chemotherapy, now there were some tumors in the bones that shrank.
Oh, shrank.
Yeah, some were gone, but some were still there, but not growing. Yeah, so by doing this procedure, we stopped the spread of cancer. But it's still there, and of course, at the back of our mind, that bone metastasis might still spread more. So it's really very important to manage
Continue
the risk,
the protocol.
continue the protocol, finish the protocol, and manage the risk factors.
But what was some of the results that your patient saw? Was she actually in pain because metastasized to the bone? And how did your protocols help her?
Okay, quite interesting, because this patient of mine, after being bedridden for a very long time, this patient of mine actually was able to go shopping in the midst of the pandemic. So I was actually more scared for her getting COVID than getting the rather than her cancer spread. Yeah.
So it's great. You actually had success with treating cancer, managing cancer that has metastasized to the bones.
Yeah.
So for anyone out there, if you have that concern, just arrange for a consult with Dr. Jansen. He specializes in managing patients with cancers. All right. So Doc, any other things that you want to share with us about bone cancer before we go to everyone's favorite segment, which is the Ask Me Anything? And I'm sure that you'll be excited. I mean, some have already sent some people send their prognosis, the diagnostics to our healthcare specialists. Many viewers do that and then ask us to explain, or ask Dr. Jansen to explain what it means. So we are always happy here to be able to answer your questions. But Doc, any last words about bone cancer?
Bone cancer is one of the more common reasons why people die from cancer. So please, if you have bone metastasis already, or you are suspecting bone metastasis, please go for a consult so we can help you manage it. Okay? So please don't delay, because if you delay further, then more and more parts of your skeletal system will be affected, and then it's going to be very painful, and you're not going to have a good quality of life. Okay, so please go for a consult. Okay?
And before we go into AMA, I always want to remind, just go and look at our past series. Doc Jansen is always very positive about the success of treating cancer and managing cancer and totally defeating cancer. So the key thing that he always advises, he just had, is don't delay. Time is your friend, but it's also your enemy in cancer. If you act early, it is your friend. It's going to increase your success rate. If you delay or ignore, just don't want to face reality for a while, don't do that, right? Just act. Our team here is very encouraging, and they've dealt with all sorts of cases, difficult ones, simple ones, and they are equipped to encourage you and hold your hand so that you can quickly go to the next step and get this cancer beaten. All right, so let's go to our Ask Me Anything segment.